we need role models. And obviously, the easiest role model is your parent. There are many wonderful parents, but they also aspire for their children where they'll have a better life. And so if you don't have parent or you live in a far-flung area, who are your role models? So it's important for us to provide role models for our children. Hi, this is Pia Cayetano. Welcome to my podcast, My Daily Race. So this episode has two parts, and this will be the part one. And when you finish it, abangan nyo yung part two. Hello, everyone. Welcome back to my podcast, My Daily Race, where we talk about everything from fitness to life, work balance, love life, health, education, friendships, problems, happiness, everything. Sometimes it's me, it's just you and me, and sometimes it's with friends. And this series right now is always with friends because I am inviting women who inspire. And so this is part of my Women's Month series, and my guest is somebody I've known, I think, for around 10 years. We've known each other professionally. I worked with her in the Senate. She would always be a resource person or with DOH on health issues because she's a doctor. So without further ado, I want to introduce you all to Dr. Beverly Lorraine Ho. Welcome, Bev.
Hi, ma'am.
Hello. I'm so
Hello.
happy you're here.
Nice to see you again.
I
after a
know, nice
while.
to see you again. I'm always happy to see you. She's always such a pleasant face to see. Usually when we see each other because there's an issue, because at first I chaired the Committee on Health, but I don't think we worked together when I was chairman of health because that was 2004 to 2013. Hindi pa. But after I was still very much involved the last 5 years in the budget of health, and of course during the pandemic. So that's so I would still think maybe around 10 years. How many years have you been in public service? When did you
8
start in
years.
public service?
I had my first stint in 2011 to 2012 in PhilHealth. Then I
Okay.
left.
Okay.
And then I came back DOH 2016 to 2023.
2011, nakikita na kita. So yeah, I was right. More than 10 years. So, but a little bit of background on Dr. Beverly Ho. Aside from, and I'm sure you can see it, how pleasant looking she is, and she's genuinely a wonderful person to chat with, to talk to about serious issues. Everyone who I've met and I mention her name, they're always like, ay, sobrang galing ni Dr. Beverly. Yan yung pinakamagaling sa class nila, and she's really going to go places, and she has. So I just thought she'd be a wonderful person to feature because I just want everyone out there to see what it takes to be successful in your chosen career, how having a successful career affects other aspects of life. May time ka ba ma-in love? Pwede ka bang mag-asawa? Di ko muna sasagutin lahat yon. Malalaman natin. And what is it like? What kind of sacrifices do you have to make? So, Bev, those are the kind of questions we're gonna ask you. Okay? Game. Okay, so we're ready. So Bev, you're a doctor of medicine, and your master's is in public health, which is precisely why she ended up doing. I end up working a lot with her because I'm a policymaker. So she actually was very instrumental in helping my team of lawyers who are also not doctors bridge that gap between very technical health matters. We were working on the CDC, diba? CD stands for the Center for Disease Control. So why is that important? Blah blah blah. And then my team, as I said, are lawyers, so we were working very closely together. Among many other bills during COVID time, she was assistant secretary in the Department of Health, and for a while she was OIC, USEC for DOH. So Bev, you're a doctor. I'm a lawyer. My first question to you is, did you always want to be a doctor?
Yes, I
Yes.
did.
Why?
Because my mom is an OBGYN. So when
Okay.
we were younger, syempre all our relatives, kung may problem sila, they'd
Sa
call
mami
her.
mo.
Yes. No? So parang you'd see na she really enjoys seeing them, even if it's weekends. No? Parang
She had satisfaction doing that.
yes.
Wow.
And then
Okay.
on sometimes during work week naman, she'd bring us to, or kunwari Sunday, she'd do rounds. She'll bring us to the hospital with her, and then we'll actually play with the nurses in the delivery room. They'd put us on the stretcher. Tas,
Oh my God.
yung parang,
That's your
so you actually
playground.
felt very at
Comfortable.
home. Yes.
So, that's interesting. Okay, kasi ako naman, my mom is a teacher, and I always, when I speak in public, especially sa mga provinces, sa mga rural areas, I always say that it's important that young people have role models. So, me, what did I want to be when I was growing up? For the first, I'd say, well, 15 years of my life, I wanted to be a teacher, like my mom, kasi nakadikit ako sa mom ko. But by the time I finished, not even finished college, by the time I midway through college, parang ayoko na. Kasi of course, I had to decide what's my course, right? So, anyway, this is not about me, this is about you. But just to be clear, the course I took in UP was called AB Gen. So parang general, may ganon. So I had to decide after a SEM actually kung ano yung lilipatan mo. A SEM or one year, you have to decide. So napunta ako sa economics. Parang I was more leaning towards pre-law pero ayoko mag-law. So my first point is we need role models. And obviously the easiest role model is your parent, right? And that's where I say like there are many wonderful parents, but they also aspire for their children to have not necessarily a degree, but in the case of Filipinos, of course, it's a degree, di ba? Educational degree where they'll have a better life. And so if you don't have a parent or you live in a far-flung area, who are your role models? So that's why this is so important to me because you are a role model for many young people. So in your case, you had your mom to look up. And for you, masarap pala. Like if you ask me, di ko naisip mag-doktor kasi wala akong role model na doktor. Ganun lang kasimple yun. Di ba? And then you meet a lot of politicians also, the role model was a parent dahil mayor yung parent nila. I meet kids na gusto nila maging police kasi police yung tatay nila or police yung tito. So ganun talaga yun. So it's important for us to provide role models for our children. Point number 1. So that was an easy for you decision to make, no? In my case again, because I was like teacher, ayoko na mag-teacher, lawyer, maybe I'll get a pre-law, then I finished it, ayoko mag-law. Tagal ko pa nag-decide. So even though yan na nga yung role models ko, I still wasn't sure if I wanted to pursue that. But you were decided all the way.
Yes.
So from high school, you went to UP, right? And you graduated cum laude, biology, and then you went to med school, right? Okay. So in med school, at that time, I know now that you ended up in public health, but at that time, did you think of being an OBGYN because your mom is an OBGYN?
Initially, yes. No?
Okay.
And also there was family expectation na you'll inherit.
Yeah, the practice.
Right.
Kami din, like sa law office, papasok ka sa law office ng daddy mo, ganon.
But my ate, who's also in med school at that time, parang she made the first decision na, oy, ayokong mag-OB because we didn't want my mom's lifestyle actually because she would come home late anytime.
So as you got older, you're seeing that na, okay, it's not all fun and joy. It's also hard. It's a hard life.
Graduation mo,
OBGYN.
you're not sure kung biglang aalis si mami kasi may manganganak, di ba? So parang, okay, we wanted a more predictable lifestyle. So my ate had the first dibs, di ba? Parang she already said, I won't do OB ha. Parang I kind of wanted to do pedia. So parang the pressure was on me to take up my mom's profession.
But pedia isn't easy either, but maybe more predictable in the sense na all doctors naman will have emergencies to attend to.
Yeah.
But yung OB-GYN, obviously, laging meron kasi anytime manganganak. At least yung pedia, medyo you have your regular clinic. Then, so nagpedia yung ate mo.
Yes, she's a developmental pediatrician
Oh,
actually.
is she?
Yes.
Oh my gosh, I have to interview her too.
Yes.
Because everywhere I go, I get a lot of questions because I did have a special child. He passed away. But then when I open up this topic, then people tell me how hard it is to we have a shortage of doctors in general, but then especially in that field, developmental pedia. Wow. Okay. Wow.
Yes.
Okay.
Yeah.
Is she with PGH?
She's with PCMC, Philippine Children's. Yes.
Oh my God. I have another whole guess, girls. Take notes. Okay. So, and then, so meanwhile, so here you are in med school. Okay,
Mhm.
si ate, pedja dibs, and then
And
ikaw.
then I think yung pinaka siguro eye-opening during the stint in UP Med was we had a very strong community medicine program.
Which is good. I'm so supportive of community medicine, which, as you know, I'm the author and I call myself the implementer of the Doktor para sa Bayan. And I always talk about the importance that the state universities that will now implement, that will now open new med schools have a community medicine. Diba? I
Mhm.
always talk about that because nagpa-med school ka nga, aalis naman lahat.
Yeah.
So you're saying, okay, sorry to interrupt, but so UP has a very strong community medicine. Do you call it a program or philosophy? What?
Yes, parang I think it's a theme, no, across
Yeah.
the entire curriculum. So the
Okay.
goal was really to make sure that graduates stay and
Yes.
serve, right?
Serve, yes.
And so I think
So
we
by
were
the way, just to be
lucky.
clear, UP, so this is PGH and
Mm.
the premier teaching hospital in the Philippines and arguably one of the best in Asia, no? Okay.
And so I guess we were lucky because at very early stage in our med school life, we were already introduced to doctors who didn't go the regular path, right? Which
Mm,
is to be private practitioners, clinicians. So we got a lot of exposure. So they had this, like, I really remember it, global health course. It was a student-led program. So they brought in, so I was like second year med school, they brought in people from WHO, DOH, si Dr. Galveston,
nice,
etc.
yeah.
So parang suddenly you see, oh, okay, all of these are possibilities pala.
Right.
And
And then
then,
you encounter this mga first year ka pa lang, second year pa lang,
yeah. So
tuloy-tuloy.
parang nag-ano siya, 'di ba? It shapes your
Oo.
mind. And then of course, the experience in PGH is what will ultimately get you to think about it, no? So during our third year, we're allowed to do our clerkship elsewhere, no? So I did my clerkship actually in the US, no?
Okay.
So for
And when you say clerkship, that's a hospital.
yeah, so
Okay.
parang you get to choose a rotation, ganyan, just to see what's out there, 'di ba?
Yeah.
And then I guess there, it's important, no? I get to realize also that, is this the population that I want to serve, right?
Mm.
I mean, definitely as an intern or as a clerk, the patients view you differently na, 'di ba, to begin with. But at the same time, you're also very aware of the fact that they have preference on who will treat them, 'di ba? And so you also begin to realize na parang there are more people in my country who need me and
And who will appreciate me.
me, 'di ba?
Yeah.
So parang
I know because my dad was treated and had his liver transplant surgery in the States. So I've had that
'di
experience
ba?
also.
Mm.
Although yung mga Filipino nurses there, di ba, are
Yes.
very well, but
Mm.
I would think iba rin siguro pag doctors,
Yeah.
no?
And then ultimately, syempre, when during our clerkship na and internship in PGH, that's where you realize na, okay, we do all the prescriptions, etc. for patients, pero if they can't afford these things,
The
walang
point.
mangyayari, 'di ba? What's
Ah.
the point? We get them super laki ng tumor, even larger than their heads. It became that because there wasn't primary care to begin with. And all of them have to flock to PGH even if they can actually be seen in their locality, diba? If there were only services. So
So
parang I
I'll
think,
pause you there, just to give an illustration of the example you gave. So yun nga, my third child, si Gabriel, was born with a chromosomal disorder, right? Trisomy 13, and he had a cleft lip and palate. So when I would go around, I talk about it openly to explain to people why I'm so passionate also about healthcare. Kasi my son was born with many health problems. So when ganyan na ganyan din yung story ko from a different perspective, from a policymaker. So when I would try to help people, I'm drawn to families that have special children because nga na-experience ko yon, right? So this is my quick story to illustrate
mhm,
exactly what you're saying. So I met this mother because kami yung magpapa-surgery nung cleft lip ng anak niya. So I was chatting with her. I think we were in the either her child was about to go into surgery or something like that. So I was just chatting with her. So, pang ilan mo na anak? Something like 7. Like, wow, 7 kids. How many do you have? 10. Okay. And she really looked like galing siya sa she looked like she had a hard life. So, okay, 10. I said, "So natutuwa ka ba? Makakaaral na siya." Ilang taon na ba? I think he's like 8 and never went to school because having a cleft lip is so hard. Like, they have a hard time communicating na, pagtatawanan pa. So these kids, like, if you don't have an intervention early enough, it scars them for life, right? Not to mention all the therapy they need to even learn how to speak properly post-surgery,
Yeah.
right? Okay. So sabi ko, "Oh, at least makakaaral na yung anak mo." Tas wala siyang reaction and I'm like, 'di ba siya na-e-excite na makapag-aral yung anak niya? Sabi ko, 'Di ba? 'Di ba makakaaral na?" Tas parang ano lang siya, sabi ko, "Yung mga anak mo ba nag-aaral?" 'Di rin siya sumasagot. It turns out, kahit yung mga anak niyang walang anything that would prevent them from going to school because of poverty, none of them go to school. None of them. So, if hindi pa namin nahanap 'tong batang 'to, hindi nga siya magkaka-surgery, but then what? Because of poverty, none of them are even going to school. So, I hear you.
So parang it's the system,
Yeah.
right? And then this is for the patient. But the other part of that equation is also me and my other doctor friends, di ba? So some of my undergraduate pa lang na friends ko who all went to med school, some of them, parang it's their family's entire investment is for them to go to med school,
Yeah.
right? And then you begin to realize na no one really tells you that practice of medicine in the Philippines is actually being an entrepreneur,
You have to run a
right?
business. You
But
do.
it's different with all other countries in the world where physicians are employees, right? So you are like every other
Although,
profession.
just to be clear though, if you engage in private practice. Because if you
Yeah,
go to a public hospital, of course you're an
you're
employee of the public,
employee.
but almost all naman would have a side practice
Yes.
outside, diba? So
Mm-hmm.
that's what you're saying, and you're not really gonna make a decent living in public. As a
Yes.
public doctor,
Mm-hmm.
which I was hoping, and maybe we can talk about it a little later, that because of our syntax law, we were able to change a little bit because it gives back to the hospitals, which is meant also for
Incentives.
incentivizing the healthcare
Mhm.
professionals. But anyway, that's another story.
So then you
Okay.
realize na parang okay, I have a lot of friends who really wanted to do this. They went into medicine because they wanted to
To
help
help
out.
people.
But then to actually practice means they have to cough up another 2 or 3 million to pay for
To
stocks in a
to
hospital, di ba?
establish their
To establish a
practice.
practice. No? So parang there's something in the system that must change for people who have good intention to get into medicine and be able to practice that. Diba? So parang at that time I remember there was a program yung parang first gentleman scholarship to be doctor to the Barrio, etc. So parang may question sa mga friends ko na, okay, if I do doctor to the Barrio, what will I get? Will I be able to jumpstart my practice after that,
Yeah.
etc.
Hindi
No?
ka
So
ba
parang
left behind?
yes, and then the entire thing just parang economically just doesn't make sense for a lot of people, 'di ba? But they were the people who I knew really wanted to go into medicine to help people
Yeah.
out.
Yeah.
But then if you're after graduation, you want to have a family na immediately, 'di ba? Parang their bills,
Then it's
etc.
it's not feasible at all
To
to
help.
take that to go that path.
Yeah.
Parang pinapatay mo sarili mo in the process.
Yeah.
Because especially if your parents, even if nga it's not naman their goal na maging bilyonaryo ka, but naman anak,
Mhm.
at least naman siguro you'll be financially stable and maybe even be able to support us in our older age or something like that.
Yes.
Yung pala, hindi talaga.
But 'di ba parang we graduate from med school at 25.
Yeah, just like law school,
Mm.
25.
And
But
then
kayo,
3 years
something
of
pa, residency or master's
residency.
like in your
Mhm.
case.
So parang, wow, there's something in the system that does not parang push people to be able to go into
Public service,
'di ba?
yeah.
So parang I think yun lang, yung parang I realized na, oh, maybe my contribution is really to help in the back end, 'di ba? Because
Mm.
there are actually many people who still go to medicine because they want to see the patient, to help out, etc. But what can we do to make sure that the incentives are there? And the system works for people who want to help out. So I think that's really my starting point in public health and public policy.
Interesting, interesting. Okay, so When you graduated, did you go to take your master's right away, or did you take you worked first?
Yeah, so I worked different jobs. So partly teaching
Okay.
in Ateneo School of Medicine.
Okay.
I did
I
mga
didn't know that.
research
Okay.
projects with si Doc and Silvestre of Unang Yakap,
Oh,
which is also your advocacy, right? So that at that time, they were just starting to get the sector
uh-uh.
to warm up again to the concept of latching, di ba? Kasi
Yes.
for a while, parang the babies are separated immediately. So I
Yeah.
was working with them as in an NGO, training mga midwives across the country and nurses na this is the way to do it again.
Right.
So we had mga dolls, etc.
Yeah,
to
yeah.
teach yun, mga health workers. And then one day I got a call from Doc Eloy Marcelo. Said, okay, one of our UP graduates is going to be PhilHealth president. He's looking for someone to mentor, someone willing. And then and I was supposed to go back to residency because I
Na
told my parents 1 year lang. I'll try to do other
And
stuff.
if ever, what would that have been?
So I actually applied anesthesiology in PGH. And if you'd ask me why, Anes, it was because we had role model Anes consultants who would do their practice early morning, di ba? So they have one surgery lang.
And then libre na for the rest of the
Yes,
day.
and I was like, I can do the rest of the time public health,
Oh.
but at least kumita na ako sa morning.
Tama. It
So
makes
yun.
sense. It makes
So I applied na and then got this call from Doc Eloy and then he connected me to Dr. Banzo,
right.
who was at that time with the World Bank and was being recruited to join PhilHealth as president. So yun, so I joined. I mean, we grew up, I guess for most of us, no one really grows up saying, I want to be a public servant, right? Diba? Parang it's not the usual thing.
It's not. I mean, unless it's a very specific thing. But not, like, kunyari, like I said kanina, police. Gusto mo maging police. Or, but yeah. Just to say public service, parang, yeah.
So parang, ako rin was like, mag-government ba ako? to do what, right? But then si Doc Dodo talked to me and said, this is a pathway for us, possibility, ganyan. So when I joined him, I think for the first time, I saw what, I guess, good governance can translate to, how it translates to benefits, etc. for the people. And so I think, suffice to say, that experience, parang I was sold na parang, okay, this is a pathway.
Okay.
Like, going to government is an option. And if you do well, you mean well, you have a good team, then you can make things work.
Okay. So, to summarize that experience, no, not just the PhilHealth, but kasi you went on to work with DOH, right? Were there enough moments of fulfillment for you to stay long enough? Because altogether, how many years ka again in public service?
8.
8, right? So, you did see naman that I am able to make a difference here.
Yes.
Yes.
And at different levels. No?
Very different levels, I'm sure. So you want to give us a few examples? Like, give me like 2 or 3 examples of what made you go to sleep at night and like, oh my God, this is why I'm here. This is why I'm here. This is why, unlike my classmates who are now finishing residency or already consultants, this is why I'm here. What were some of those moments?
So I think what is clear to me, 2 things, no, going into it. That in public policy, you can never attribute any policy success just to yourself. Diba? Parang, you're always just a part of
moving pieces.
Yes, diba? And parang may part no na you're fortunate to be in that phase na maybe an idea has matured already.
Totoo,
and
totoo.
ka, diba? So parang we need to take everything with, I guess, a lot of humility then.
And patience. No?
Yeah.
You're right. Because like I try my best to the best of my knowledge when something finally happens. Like in my case, kasi I'm a lawmaker. So napasa na to. I try to credit everyone I remember working with even way back. Kasi nga, alam ko talaga na I can't do what I'm doing now, that it became a law without the work that was put into place by the people who came before me.
So parang may policy window na swerte if you're there.
Yeah, exactly.
And then the second piece is really around critical mass. Parang, I don't know, I think parang while growing up, my thinking kasi sa UP, diba, na parang, okay, UP people go into government, they change things, etc., diba? But I think after working for a bit, parang you realize na, especially in bureaucracies, it's never just the head, diba? It's actually a lot of the people working day to day, the middle
Oh,
managers,
yeah.
etc., diba? So parang I'd say na parang the reading for the health sector is we're never really able to maybe breach certain challenges because kulang pa rin, no? Yung critical mass is really not enough. So I thought that parang part of the goal going in government was to always use the work as a platform to bring other younger people in,
How
etc., diba?
nice.
So I
Okay.
guess parang I think yun yung metrics ko for saying
I
uh,
did my part
I
or
did my
successful
part,
naman.
no? So it's really opening doors for other people because in the same way that more senior people open doors for me, even as
Correct.
a young person, woman, di ba? Parang that was important that you were heard, that they gave confidence
Yeah.
um to what you can contribute.
Yeah. So you're
So
able to do that for younger grads?
yeah,
I
so
mean, I know you because just by seeing you, hearing you talk, I'm sure you did, but you have direct experience with these. Like, nag-recruit ka ba directly? Yeah, talaga.
So, in my first few years in DOH, for example, so I was doing policy research program. So part
Oo.
of the research funds we dedicated for a fellowship program. So that was to
Oh,
bring in young people who would do in-house research because ang
right.
tagal to commission work,
Yeah,
right?
yeah.
And so that was an opportunity for us to train them,
Right.
to get them
And
familiarized with
expose
the
them to your world.
bureaucracy,
Exactly.
right? Because sometimes if parang some people have been working in the sector for a long time, pero kung walang exposure to bureaucracy, the quality of the advice is very different, di ba? Parang it's as if, oh, we do this in whatever sector, whatever country, just do it. But no, it's
No.
not as easy, no.
Yeah.
So I think yon kasi many of those young people now end up, being successful in their own parang subfields, no. So like one of our younger staff before, we were just starting out with HTA. Like we were piloting HTA
Oo,
in-house.
oo.
So si Dana was a
HTA is Health Technology
technology
Assessment.
assessment. So she was a young economist at that time.
Mm-mm.
She came in to DOH. We got a lot of help from other countries. They were training them. So they were doing in-house HTA with 3-month
Yes.
turnaround time
Wow.
before.
Wow.
So eventually, Dana now got the PhD in HTA.
Oh my gosh.
Right? So
Really?
parang we'd be happy to have her back home, 'di ba? Pero parang they're better than us, right? They went into and really studied these fields.
Yeah.
And parang it deepens the capacity of the whole country, 'di ba?
Of
Parang yun
course.
yun. So parang it's really these opportunities that make you say na, okay, worth it na kasi parang dumadami yung mga tao
Yeah.
who
Yeah.
know how to
Yes.
work with and inside and
Mm.
for the government,
Mm,
'di
mm.
ba?
Yeah, super. I mean, like I said, like I'm a lawyer, but I work in health policy. So it's so important to me that my team can work closely with the experts and we can understand it enough to make meaningful policy. Kasi kung hindi namin maintindihan, baka hindi rin namin masulat yan in a way that you guys need. That's why you're also very instrumental when you were working with us. But eventually, Beverly, you left public service, right? And is there a reason? I mean, is there a main reason for that? Do you want to talk about that? Was that a difficult decision to make?
Definitely po, no,
Yeah.
parang I enjoyed my time in the DOH.
In between all that, you got your master's in public health.
I got my master's before I went to the DOH.
Okay, so tapos ka
Yes.
na with your master's in public health
Mm-mm.
and you got it in the US
Yes.
from a very prestigious school. Graduate ka saan?
Sa Harvard
Sa
po.
Harvard. Sa UP lang naman tsaka sa Harvard siya graduate. Okay? Okay. So, what year was that?
2014.
24. Tapos ka na by 2014. Is that 2 years?
1 year.
1 year.
2014 to 15.
Public health. Okay.
Mhm.
So, yun na nga. And then, comes the decision, I don't know, is it 2 years ago when you left public health?
Yeah,
I mean,
January
public service.
2024. Yes.
Okay, so how did you come to that decision?
So I got married.
Yeah, so nakita ko na lang sa Instagram si Miss Beverly na mga once a year mag-post. Kasi sa sobrang busy ni Doktora, hindi yan nagpo-post. Aba, biglang nag-post. Ang daming post, syempre kinasal naman siya, di ba? Pero parang at the same time, I think around that time, I found out that ano ba yung nauna? Yung resign from public service or yung kasal? Kasi kinda
Kasal,
around
and
the
then I
same time.
resigned. Yes.
Kasal and then you resign. I think nag-post na siya kasi nag-resign na siya. Hindi dahil kinasal siya, pero naka-resign na siya. Doon na siya nag-post.
Yes.
Okay. So that was part of... So, are you saying you left public service because you got married or no? No naman. But it kind of was part of the path?
Yes, it was part of the path. And also, I think 8 years in service, I can do more. But at the same time, I also know what my limitations are, right? So I felt like, so if I would to retire by 60, I actually still have a 20-year runway, right? And I kind of felt like I want to learn something more. So, for example, in the DOH, so nag-PhilHealth na ako before. So like financing,
Yeah, alam mo na yan.
I was doing policy, and then suddenly health promotion, and then the public health programs, right? Which we were closely on.
together.
So
Yeah,
mental health
she was always the
together.
resource person in my many my need for somebody we can understand in layman's term.
So I think I felt like the next step is really to know more about operations.
Okay.
And that's something na parang kind of like difficult to do within the DOH na wala akong alam. I never really did like hospital management, etc. But then, well, they suddenly expect me to run a hospital or
Medyo
etc.
mahirap yun.
Mahirap.
And there would be other more qualified people to do
Yeah,
that. Something like
definitely,
that, diba?
So parang I felt like, okay, the natural transition really is probably to go out first, try to learn something else. I guess in the future, nothing's stopping me to
of course.
go in, right, and help again. But I think at this point, parang I just wanted to make sure that I'm learning something
Continuing
new,
to always learn.
right?
Yes.
And so it's kind of like starting out again. Diba? This is what it is. And I hope it's gonna make me a better public health professional overall. And now being in the private sector gives me a lot of insight that
you didn't have before.
yes,
Insight that
diba?
hindi mo specialty. Ngayon, medyo ano mo na, expert ka na rin doon. So you are now Chief Health Officer of Ayala Healthcare.
Yes.
And what do you do?
So basically, we're a holding company for a group of retail pharmacies.
Okay, so pharmacy.
Medicines importation.
I didn't know that. Okay,
Yes. And then generics medicine importation.
Okay.
And then a provider group. So that's clinics, hospitals, clinics within workplaces. Because diba DOLE has a regulation that if you have employees beyond a certain number,
you have
need
to have your
a
clinic.
yes.
Okay, so ganun na yan, parang privatized na yan, ina-outsource
it's
na yan.
outsourced,
Okay.
yeah. So I work with a group of people who run these businesses, and basically my role is to bring in opportunities for synergy, right? So how can the provider group and the retail pharmacy group work together so that we give a new or a more innovative way of delivering services for patients in the Philippines, and at that more affordable also. Concretely, it also means how can we inject typical public health programs that private sector usually does not want to touch
Right.
into this space. Right?
Because that has been your experience. So you bring now into the discussion what possibilities there might be.
Yeah. Yes.
Wow.
So for example,
Okay.
like when I was at DOH, because I was working with a couple of NGOs who were really championing HIV work.
Right.
Then parang I felt like, the private sector man pala is already into it. And now going into the public sector, in private sector now, you realize na, for many of our clients, it's still taboo pala to talk about it, right? So
And
parang
yet here you are immersed with these NGOs. Akala mo everybody talks about it.
exactly, right? So parang then now, it's a way to introduce these programs.
Yeah.
And actually, willing naman yung mga HR of the companies that we talk to, diba? It's just that there wasn't probably just enough
Yeah.
opportunity to
Correct.
get them to do it, no?
Correct.
So parang it's really trying to marry, and siguro dati din in the public sector, di ba, you're used to, okay, once it's written down, you kind of expect people to just do it because that's what the relationship of DOH and local governments, di ba? Parang if it's a policy, let's just try to help you implement it.
Yeah.
But now, of course, there's really a lot more at stake na parang there's a lot of convincing that needs to happen, their preferences.
With the private sector, you mean? Because
Yeah,
you're
diba?
okay. Let me restate what you just said. Pag local government kasi, if it's a national policy na wala naman choice si local government, gawin nyo na yan. So
Yeah.
once you do your part na you come up with a policy, you expect local
Yeah.
government, just get it done. But here you are with the private sector, ay hindi pala ganun.
It's not,
I
right?
mean,
So it's a lot of
yeah, and there's a lot. There's like, is it profitable? Kasi not all, but most are for profit. What is their role in the community?
yes.
Diba, like, is it even their job to do this? So, kasi if it's not their job to do this, then why would they want to do it? Is it feasible for them? Is it an advocacy? Or is it, yun nga, a profit, is it a profit center, diba? How interesting.
So parang yun. So parang it's learning all of these and then really also seeing na, okay, we really had some regulations that are very challenging to follow, right? Or they're not even cascaded very well, no? So parang now it's really seeing that na, okay, kaya pala these programs don't work before kasi this is how the private
It
sector is
is.
understanding
Yeah.
it, diba?
So that's not interesting. So take note, my staff, we have to have another dinner. Papakainin naman natin si Dr. Beverly Ho. At ngayon puro utos, puro kwento. So that we can hear that part naman. Kasi me, I'm still a policymaker. Unlike you, I'm still in public service. So I want to hear that side also. Kasi although as you know, I try to engage also with as many sectors. But syempre, ang nado-dominate ng discussion is DOH kasi sila yung nagsiset ng policy. And then we try to listen, like, because I'm very close to a lot of LGU heads. Of course, Taguig in Point, my sister-in-law, Mayor Lani. So, yun yung perspective nakikita ko. But there's also the private sector na I do try to engage, but yeah, now you can also help me with a fresh perspective. Hindi na yan pang podcast kasi baka tumulo na luha ng mga nakikinig sa atin dahil it tends to be a bit on the technical side and maybe not really conversational. So we're going to cut here for the part 1 of this episode with Dr. Beverly Ho. And after this one, abangan nyo the part 2 to hear the continuation of her stories, including her love life.